Hi guys, this is our new episode of Digital Health Vitals. Last month we did this live at Health to Tech event in New York during New York Tech Week, and we loved to record this offline so much, so we're doing it again.
Welcome to our conference room.
Woo! So traditionally we have Sergei Polevikov, Stephanie Davis, and today we have a special guest who I'm really excited to introduce. His name is Amit Phull. Hi Amit.
One, thank you for having me. My name's Amit Phull. I'm an emergency medicine physician. I'm a clinical assistant professor at GW in DC, and I'm Chief Clinical Experience Officer at Doximity.
Awesome. Excited to talk to you today.
Absolutely, likewise.
Let's get straight to the news. A lot happened in June. I was hoping everybody's going to take vacations and nothing's going to happen, but it didn't work that way. So let's go with the first one, the article on nature.com that says general purpose large language models outperform specialized clinical AI tools and medical benchmarks.
I mean, of course they do. They have the money to invest all of their dollars in having a better large language tool than anything we can use in health tech. And most health tech AI solutions are based off of one of these foundational models, right? Of course it's going to be somewhat better, but you don't use a health tech solution because you want it to be better than one of the foundational models. No, you use it because it probably has an extra level of compliance or something on top of it. So a hospital feels comfortable using it, or a doctor feels comfortable that they're not just getting some reference from a random person on Reddit, right?
Compliance, that's the word.
Some security and compliance is the reason a lot of these health tech companies exist as separate companies.
No, it was a distant study. It was a peer-reviewed study. So I've checked the names of the researchers. They're pretty renowned. 3 benchmarks, the limitations.
Wait, so this study you specifically believe? Because most of the numbers I give you are like, I don't believe that.
Yeah, you respect these numbers. These must be really good researchers.
No, I was just trying to give an opposite opinion just to create a discussion. No, but it's better than some company finance publication.
Tell us what this means for the industry, or it doesn't mean anything.
Look, I was talking about it for 2 years. I think it actually means a lot, because I think this is maybe the first study outside of what I was talking about on my Substack 2 years ago, when I observed that all these frontier models are getting so powerful that despite seeming expertise in data sets and partnerships, in OpenEvidence's case, they think because they have special exclusive partnership with New England Journal of Medicine, with JAMA, they should be better because they're building on top of that same frontier models that just beat them. So logically, they're thinking, oh, we should be better. But that's not exactly how it works. First of all, fine-tuning, as you know, as all you guys know, building a RAG system, it takes an effort. Oftentimes, you cannot just convert it from one model to another when, for example, OpenAI comes up with a new model like GPT 5.5. It takes work. You mentioned compliance. Yeah, so by the time they finish all that, the next model comes up, and they may be addressing not everything, obviously, but a lot of clinical needs better. And so on this particular benchmarks that have limitations, obviously, authors are not hiding them. OpenEvidence was all over them, but they're pretty open. They're saying, yeah, there are limitations, but still.
Tell us how you really feel about the OpenEvidence reaction.
But yeah, I mean, I think it's interesting. Again, I said it 2 years ago. I said to have clinical AI as a moat, to me, is not a sustainable strategy for a business.
But that's not the strategy for any of these health tech businesses, right? Why does Viva exist instead of just being an instance of Salesforce that was inside of Salesforce? Because a lot of selling to health systems and the medical community requires a lot of specialty sales, and it requires a lot more trust, and it requires a lot more compliance. And I think a lot of existing tech companies that has the whole move fast and break things ethos would really appreciate. That's what you're paying for with a health tech company. You're not paying because you think they're going to have a better model.
Yeah, I would agree with that from like the company perspective for sure. To specialize in the healthcare space, you have to have specialized Salesforce relationships, et cetera. There's an up-leveling of the compliance that's necessary to be medical grade. From my perspective, I'm an emergency medicine physician, just kind of viewing it as a clinician. I think the reaction is more important than the paper itself. The fact that the paper exists is very important because I would venture to guess it's the first of many. And the concept, frankly, of independent evaluation entering a space where to date, almost all of the claims being made are unverifiable, random claims that are hard to contextualize. I think it engendered a debate that's just going to continue and probably heat up, right? So I work at Doximity, a competitor in the space, and our approach is a little bit different, where we try and actually just divulge how we operate.
Docs and dorks.
Docs and dorks, there you go. And then we actually produce vetted and audited data so people can react to it. And we think ultimately once kind of the fever dream, everyone like relaxes a little bit, that will rule the day. I just don't know the average clinician that I saw kind of participating in the debate. A lot of it was surprise, right? Because to your point, you kind of came out and you're like, of course they're better. A lot of clinicians have been being told for the longest time the exact opposite, right? So they've been kind of inculcated to trust things more because it's special in this way versus that way. And I think that's a healthy conversation to have as to whether or not the inherent technological limitations prevent us from doing some of the things that people claim that these technologies can do. But just as importantly, how can we actually, as consumers of these technologies, better discern between one offering versus another? I agree, though, when it maps over to business, or frankly even point of care usage, it's actually understanding what point of care usage is that will differentiate a health-specific application from one that is just kind of more general purpose. So I work at a couple institutions that have domain blocked OpenAI, as an example, right? That makes it very difficult at the point of care to leverage a frontier model if you're trying to utilize it when taking care of a patient. And that's where I think healthcare-specific applications might have a leg up.
So you guys are saying that OpenEvidence didn't react to this news, to this research really, really well?
I mean, I said this on last episode. I really think, and we have a Doximity person in the room, so this is probably going to be backed up, they need to start learning how to play nice in the sandbox and start working with the rest of the health tech community and healthcare in general versus throwing other folks under the bus. It's not a good look. And it kind of misses the point of healthcare. We're trying to help people.
I just think in the end of the day, we need to have a healthy debate and without like throwing punches and being defensive. I think it speaks to leadership, to culture within the companies. To me, when all this Twitter storm came out, it's almost like there was some kind of a conversation within the company. Oh, can all of us respond to this? Because they like literally came out almost about the same thing. And actually, some of them making good points, like about the benchmarks. But again, like the authors never hit that information. So yeah, we all know the limitations, but at the same time, I don't know. To me, it's like it's as independent, peer-reviewed as you can get. And as I said in my article yesterday, I guess depending on when this is going to be recorded, if you want to respond in a proper way, just have your own peer review study and see what happens.
Agreed. Like, there's nothing wrong with having some debate in the industry. I think it needs to be done maybe in a way that's a little bit more productive, but also, you can disagree with the study, you can have your own counter study, and then you can show folks that you're better, but...
It's still going to be biased, by the way, because it's going to be OpenEvidence study, but yes.
Well, they can release the methodology of the study, and maybe one day you'll agree with it.
I would agree with the point that I think you just made, Stephanie. Like, the adversarial framing is unnecessary and counterproductive. That's not why any of us...
They've done some interesting things with Doximity, too. It just feels like, what are you doing? We're trying to help doctors.
I'll leave it to you all to decide and debate what it is that different people are doing at any given time. But the extent to which I can speak for myself and our organization, the approach that we think is healthier is to engage proactively so that we can up-level the outcome for everyone that participates. it's easy to forget that it's relatively early in terms of a very slow-moving ship that is healthcare in the United States being introduced to the fastest rocket that has ever been created before, which is artificial intelligence technology. And I think the collision, if you will, of those two vectors, there's just some rough edges to it. From a clinician perspective, what we hear from folks is we just want to know that we can trust the software and use it safely in a way that gets me home a little bit earlier. And if we can focus on that, I think we can move past some of the food fighting or whatever else comes out in response to. For what it's worth, as Sergei mentioned, it's a paper, right? It was it passed whatever gates needed to be passed to be published in a non-trivial publication, but it's probably the first of many. And as the technology evolves, I think hopefully the conversation will evolve as well and become a little bit more positive.
I mean, I think the real shame is it becomes a detractor from OpenEvidence's story. At its core, it's a solid product. There's nothing wrong with the product. A lot of doctors use it. It's the same way how if you mention the name Eric Schmidt, I don't think about Google first, right? You mention OpenEvidence now. I don't think about their product first, and that's not going to be great if they ever want to go and come to market in the public markets.
I love this point. Hopefully some of those folks are going to listen to us and maybe change their communication strategy, but we'll see. Let's move on to the next news. UnitedHealth bets $3 billion on AI to cut costs and ease industry backlash. I feel like this news got a lot of attention. I think the number is pretty impressive of the investment, and it's obvious all the payers are using AI already, hopefully not just to deny claims, but for other good stuff.
Don't forget they employ 1 in 10 doctors in the US. So anything United's doing with AI, yes, everyone thinks it's going to deny claims, or there's that point in the article where they're using it to robo-dial doctors, oh no. But they're also trying to make the systems more efficient. Otherwise, they too would be a loser in that.
I agree. What do you guys think?
I mean, I can give a serious view and a humorous view.
All right, let's.
Yeah,
you want to break the ice with some humor, or do you want to just
well,
go?
not humor actually, not humorous for United, just in general humorous. But I think it's kind of interesting that right now they're still in the middle, actually very middle, because they're still having hearings of investigation, DOJ, for upcoding and other fraud, alleged fraud. Wall Street Journal came out last year, I think, about the allegation about $50 billion upcoding fraud. I think DOJ was mentioned a different number, but it's still crazy numbers in billions. I read, it was actually on LinkedIn, but they're referring to health nerds conversation. So they're giving all these doctors giving these examples how some AI scribes are being optimized for essentially upcoding, because there's a conversation and doctors looking at it, it's well, I didn't exactly say that. And yes, we had a conversation, but we didn't exactly talk about health planning, which is a separate code that you can charge more money for that. So it's pretty clear some of the AI scribes in this industry, for example, are optimizing. So I don't know. To me, it's the maybe humorous or not so humorous view is that you're in the middle, you're a domestic player in the industry, the biggest player maybe. You're in the middle of the DOJ upcoding investigation, and you're essentially thinking how to do more upcoding. So this is kind of my very kind of simplistic, humorous view on that. But there's probably true somewhere in the middle. They probably want to be more efficient. The criticism I've heard, I was looking through various analyst reports, Morgan Stanley was saying that, in their view, it could be. I think they use the term. It could be used to make bureaucracy more efficient, but it's still the same bureaucracy essentially.
Well, it's a question that the bureaucracy is a unfortunate outcome of the system or a function of the system that is, maybe purposely built.
Well, United is the system essentially right now. So yeah, I'm pretty sure it's purposely built. And so, I mean, we'll see what happens. I mean, it's a lot of money, and let's see what they built. It's still a lot of announcement. It's interesting that I think they said 99 around that number % of this AI efforts they're gonna put toward automation and sort of workflow optimization, all that stuff, and sort of in order to cut costs. But we'll see.
There is a lot of admin waste in the system. Let's not forget that. And I think the allergic reaction that a lot of folks had to it is kind of a proof point that if you're going to build AI in order to get rid of admin costs in the system, try to ask why some of those steps are there, and if that needs to be optimized to be a faster and efficient step, like calling the doctor, versus maybe if a new system needs to be created entirely.
Yeah, I think there's that Drucker quote, and I'll probably get it wrong, but there's nothing so useless as doing something more efficiently that you shouldn't have been doing in the first place, right? Exactly. And I think that
sounds very healthcare. That's a very healthcare line.
Probably the through line of all of these things, and I think a lot of companies, I don't have an opinion, yay or nay, here today about United specifically, but they're going to suffer from a lot of people reacting to what their gut opinion is of the organization anyways, right? To your point about Eric Schmidt, or like anybody who has developed this perception is, I think, going to be dealing with more significant versions of reactions to that perception, even if they're doing something in good faith, frankly. So if enough time is given and they can point at legitimate cost savings or efficiencies that can reduce some of the issues that exist in the system, and good for them. Like, that would be great, right? But I think the reaction right now is skepticism, because it started with United, that people probably come to the table with their own opinions about.
If we wanted to remove some of our bias, I would argue that United has the deepest pockets available in this industry to actually make an investment in AI. Yeah. So we should all really be cheering for them.
Absolutely. Yeah. Who better than somebody who employs 1 of every 10 doctors?
There's the money to do all this.
Also has, some fairly deep coffers to be a proof of concept, right? Like, if you can actually leverage this technology and refute some people's concerns that it's actually just going to result in a massive upscaling of costs, I think they would be a really great organization to prove that out. That could be super interesting.
But I wonder what doctors think, because one of the potential features is AI calling doctors. I wonder what doctors think when they're going to get a call from AI asking all kind of questions.
So I think that depends. I don't know the details, I will concede, about what those calls are about or what they're supposed to accomplish, but I know on the clinical side, there's lots of evidence that's beginning to be garnered, and hopefully some papers that'll come out about this soon, that for some of the administrative tasks that do involve calling people, an example, at UC, they use AI to call patients that are prepping for colonoscopies. They've actually seen significant increases in compliance, preparation, a reduction in missed appointments. There's ways to leverage what sounds like in a headline something that's super annoying, but it could actually be valuable. So I think if you give them enough time and they feel enough pressure to actually point at results, I'm happy to take a phone call, even if it's a robocall, if it reduces 10 other things that I have to do in my clinical day. So there's potential upside there, I think.
We'll see what happens. I mean, it's still a monopoly, so it's...
No, it's not a monopoly.
No, it's not.
It's okay, oligopoly, whatever. It has tremendous power. In the end of the day,
I feel like you have this bag of like hater words and you fish around them and you're like, monopoly.
So what else do I say? No, but like, if you just go to like Economics 101, and actually it's proven in UnitedHealth. I mean, first of all, they're like, logically, they like the status quo because they're making monopoly money or oligopoly money, whatever. So whatever they're doing is to definitely not to weaken that position. And any deviation, I would imagine, like any oligopoly would be dangerous. So I think all this announcement they're doing because different reasons. They have the board. They want to have nice press releases, especially in the age of AI, but whether this is going to be implemented like the way we discussed, we're yet to see. Especially since there's massive like fraud investigations going on. They always settle because of their influence. I've noticed like their lobby, whatever, and they're hoping it's going to be settled here. But that goes back to my suggestion that you know, in the end of the day, they're the monopoly, they're the oligopoly. You know? So we'll see.
All right, let's move on to the next news. Innovation came from somewhere we did not expect. But first I'll ask you a question. Who likes to go to the spa?
I just feel like you're looking directly at me. Obviously I do. I mean, yeah, of course. But I bet they do too.
Do you?
Yeah, of course.
Yeah, who doesn't like the spa?
Spa, yeah.
Yeah, you would actually find a way to hate the spa. Everyone else is like, the spa is so lovely, and you're like, oh. Saunas, everyone else is there.
So hot.
The steam room is too humid.
Well, Midjourney, yes, the company that started generating images, AI images, came up with this press release that everybody's still talking about for the past 10 days. They are building a new version of MRI in sauna, basically. So you go in there.
It's not a new version of MRI. It uses ultrasound tech.
Okay.
It's different.
It is different, I agree. But
We have doctors that watch this.
the idea is very simple. You go to spa, you relax as always, and the device is gonna collect all kind of measurements about you and about your health. Would you wanna go to that type of sauna?
I mean, so I'm a weirdo that gets like full body MRIs. And so I may be like, I am the exact like wealthy, well
So you're already on the
demographic
wait list.
that they're targeting. And I know the whole idea of a full body MRI, I'll get all these false positives, things like that. Look, I'm just tracking it and I'm paying out of pocket for it, so I feel okay with it. I think it'd be very hard for them to get reimbursed for that. And that's probably what it's going to come down to. You're going to exhaust the me's of the world that are going to go and buy that, and then you're going to actually have to come up with a sustainable business model. I don't know if they're going to be able to do that. But my full body MRIs are really unpleasant. Even though they play Ariana Grande in the background, I still hate lying there for that long. So it would be nice if it was in a spa-like environment.
Yeah, I'll say this is where healthcare and business don't necessarily always play well together. From my read, for what it's worth, I don't have an opinion for or against Midjourney. Interesting company. If their technology actually bears out the way that they projected they could, then
Would be great.
hell yeah, that's great. Like, that's a dramatic advancement in terms of our ability to image. My cousin's a neuroradiologist. When I read their kind of forward-looking statement, I just called him real quickly and I was like, bullshit or not, I don't have enough time to like talk about this right now. And he's like, that was literally his response, right? So I'm unaware, as was he, of any actual evidence about this modality, what it produces, how it actually leads to diagnosis, et cetera, et cetera, et cetera. I understand that their plans are, I think, in the end of 27 to have one of these spas in San Francisco or something like that.
And they're using real tech. They're using butterfly networks, right?
Don't get me wrong, I'm a user of ultrasound in clinical practice. It's fantastic. You can actually make diagnoses of a limited scope of things at the bedside, and it truly does advance your ability to practice or get a quick idea as to what's going on, and you can confirm it later. What I don't know, because I'm just unaware of this having been studied, is the actual like dipping yourself in a pool with all these like particular points of information being synthesized into a useful bit of like medical output. I think the jury's still out on that. If that's true, well then yes, that would be a seismic shift. I think you would enjoy a 60-second dip in a pool more than a 60-minute lay flat in an MRI that's making all these noises around you. But the fervor around something that, as far as I'm aware, is not rooted in any actual science that currently exists, I think is indicative of what's going on in the broader space, where it's like announcement fever as opposed to, hey, we actually have this technology that has been shown to be comparable to an MRI. I think every doctor in America would lose their shit if they actually released that paper and it was real. That would be absolutely fantastic and a step function advance for the practice of medicine. So I'm like cheering for them, frankly, from the background. If that's the case, then I have many people in my personal life, even beyond my patients, that I would send in that direction because it's a lot more pleasant than getting an MR if it's ever proven to be even remotely as widely usable as an MR. He just doesn't like heat.
No, I agree. I'm actually cheering
I like
for this
how our
guy.
consensus view over here is like, I really hope it works because I will help medicine. And you're like, no, everything's awful.
No,
And the pool water is a little too cold for my liking.
Well, there's too much chlorine. No, I hope it works. I mean, I really like the fact that actually David Holtz didn't take any VC money. Do you know that?
Oh my God, I was thinking that when I was reading it.
Totally
I was gonna love that. This is like
I love
bootstrap.
this guy. Yeah. So we'll see. But I agree. I mean, everybody's cheering for them. I don't think like anybody is not cheering. It's just that I mean, I have to see it. I mean, David Holtz himself said like, we haven't done this before. Nothing is tested. This is our first try. We want to do this. I mean, yeah. I mean, if they succeed, I mean, I think that's going to benefit to the whole technology.
Consensus positive view.
No, I was just gonna say, but at the same time, we have history to kind of like similar, not similar products, but like people trying to do like similar things, like Ford and Preneur, yeah, it was like I mean, Azure is doing that, right? And like in those actually like longevity plays. Cases, as you know, like economics doesn't always work. So I mean, it was just
you pay for it. The economics for all these longevity doctors is you pay them an obscene amount of money, and then they do everything.
You pay for
why not,
it,
right? Why not? I might as well figure out if we can get some sort of extra data points on you.
So like similar subscription model that David Holtz is trying to start with, like the same model didn't work for Ford, for example, because as you know, they were paying actually same price. They started with $100. I think it was later $149 for Ford, and then they were paying $1 million plus per their care pod. Didn't work out. Promised $3,200. This guy's promising $50,000. Like much crazier number even. You know how many care pods were built? Promised $3,205 were built. So it's like, three. Anyways, so anyway, I mean, we'll see.
Very strong TBD.
Very strong TBD. Yeah.
But I love the press release talking about communications. I mean, I'd love to see. I was enjoying watching the videos.
Do you feel like OpenEvidence should call up their team and say,
yeah, rehire someone. All right, and the one for today, Abridge unveils patient-centered clinician intelligence platform connecting care delivery, payment, and evidence-based treatment. So they had almost like Apple-style release keynote. I think all of us were watching that, or at least a summary by AI of that. But yeah, I think it makes a lot of sense. They started, as most scribes, with the consultation itself, so basically where the patient and doctor meets, and now they're expanding to much more. Even like post visits, nurse assessments, paramedical necessity, and many other things. So I think it's a very logical move everyone was anticipating. So it makes sense. What do you think?
You know how they say, like that joke, like, oh, the children yearn for the minds? Health tech yearns for the EHR. Like, we just want to go back and create another one of those. It worked. It was the last business model that really worked. And it sounds a lot like Abridge is creating the EHR piece by piece, right? Like, they're slowly moving into doing what every
I hope
EHR did.
Epic isn't listening.
I'm gonna get shot out front after this, but yeah, I mean, it seems like we're going to eventually move there, and I think that would actually reduce a ton of friction in our existing medical system, because how many doctors have you called up and said, hey, do you like your EHR? And they've said, oh yeah, absolutely. It's like asking me like, oh, do you enjoy Time Warner Cable? Like, no one does.
I mean, I know Shiv, I know a lot of the leadership team at Abridge. I have a healthy dose of respect for them. To your point about it being Apple keynote style, anything that they do with an incredible amount of finesse. So at the very least, mad respect for that. I think the problem, going back even to the first, or maybe it was the second question about United, is like viewing the system as if it actually was a system, right? Like a single point of influence is not going to change how everyone does healthcare in the United States, right? Like we use this chart that came out actually from the US government. We often use it internally at Doximity for presentations, but we started sharing it with clients and partners. But it's the US healthcare system as mapped out by the US government. And it's just like, it's difficult to look at, right? So even if you have...
America!
Yeah, well, I mean, like if you have... even a really great technology, implementing it, deploying it, supplanting kind of incumbent technology is very, very difficult, even if it's AI everything, right? So I actually think the idea logically tracks. Like if you can leverage the conversation where this information exchange is taking place and then utilize it and operationalize it across all these other endpoints, that would be phenomenal. But that is a very complicated task to accomplish, just given all of the component pieces that exist and would have to be swimming in the same direction. Could you do it in small little nodes and point at it as a success? That I would be a lot more confident about, but I don't think it's going to become like an operating system layer for all of medicine, which I think is the ambition. And as a clinician, I'm a fan of like swimming in that direction. How that actually nets out, going back again to what is the difference between running a business and like actually leveraging technology to change healthcare delivery, I think those things are often at loggerheads with one another.
Here's a follow-up question. If you see a bunch of announcements like this and all of these different, ambient voice technologies starting to go in the direction of putting in coding correctly and doing all of that, how scared are you as a revenue cycle company?
I'd be scared if I was for sure.
Yeah, absolutely. I mean, it has the potential from the technology perspective to eat a lot of things on the way, for sure. We were joking earlier in a conversation unrelated to Abridge. I work in an emergency department, and it's hard to find like a working ophthalmoscope rather than like a high fidelity microphone that's going to like run my ambient decision making and like launch all of these processes, et cetera. So the idea and the delta between the idea and the promise and like the practical reality for anyone who's been in a hospital setting or even a private clinic, I don't know, maybe at the Midjourney spa, like everything would be perfect and like working, but
you'd be paying for it.
Yeah, most of the other places where people practice medicine, there's like 19 other things that are going on that complicate the vision. Should we continue in that direction? Absolutely. Is this like the solve? TBD, I guess, is the theme from me, but that's the skepticism from the clinician's perspective. It would be great, would be the best way to characterize it.
Yeah, I want to go back to an announcement. Like we talked about this paper in Nature Medicine, but like I'm actually curious because my understanding from the announcement that they're actually going to train their own model, their clinical AI, on Blackwell chip, which is like, I mean, we talked to Shiv, very, as you said, very ambitious guy, very smart guy. So I mean, it's taking all this. We were talking like in my question, maybe not such a smart question, looking back, saying, well, we cannot really compete as clinical AI, like in case of Doximity, OpenEvidence, because they're like so much better. I mean, it looks like this guy is like taking on those frontier models, which is amazing. So we'll see what happens. But it's very interesting. And obviously, NVIDIA has been helping, supporting them for many years through their ventures arm. So it's an interesting partnership.
Yeah, there's been a raft of announcements. I think Mayo partnered with Microsoft also on a foundation model. I think there's a couple other examples in the space as well. And I'm not even trying to be skeptical about them. That's great, right? Like more time and attention should be spent in this direction. What happens when you take a broken, disjointed system and then have a broken, disjointed system of models? I don't actually know the answer to that. And that's why I think the word system itself is a little bit of a misnomer. If we create this like future state where your health is completely contingent upon the random door that you enter and what model is powering that whole exchange, I would probably argue that's a fundamental rewiring of the system in a way that might be net negative. I don't know how that would play out. How do you actually account for disparities of things between things that are moving so rapidly with people who are spending billions of dollars in all these different directions? I think it takes like a broken thing and makes it more broken in a way. I think that's going to be the fundamental tension that anybody who's trying to point this technology in the direction of healthcare is going to run into eventually. And God forbid if like the government gets involved in this, then who the hell knows what will actually happen, right? So I'm cautiously optimistic that technology can unlock efficiencies. It can certainly augment our approach. For an example, very small in the corner, just minding our own business, we can augment the output and effectiveness and efficiency of the individual clinician. Rolling in and trying to just turn the entire system on its head is a completely, entirely different endeavor that I don't think technology alone will solve for.
I think healthcare's brokenness and our inability to adopt technology so far is actually like the great advantage that we have in adopting all of this AI. Usually if you look at any other industry, let's say finance as a great example, in order to go and adopt a lot of AI systems, you have to go and say, okay, we have this giant tech investment we've made in one area. Let's just scrap that and replace it with a bunch of AI systems. The brilliance of health tech is we did such a bad job of investing in tech that we're saying, you know, we actually don't have any systems in place. Maybe we can go and use some of these new foundational models and fix some of this. And you don't have to worry about the spend you've already had because you kind of didn't. And then you think about all the different reasons why people haven't replaced some of the Cerners of the world, or like, you know, the existing kind of brokenness of different systems. It's usually because they'll say, I mean, does anyone still program in COBOL? Like, how do we even do that? You actually have a machine that can do that now. So this is, I'm hopeful. I'm very optimistic on it.
Hopeful? All right. Couple minutes we have left. So last question to you guys. SpaceX went public, huge IPO, OpenAI and Anthropic are going public soon. Do you think there's going to be any effect on healthcare from those IPOs?
Yeah, I had my opinion on that. I think it's, by the way, great developments. It's kind of like the pinnacle kind of American innovation. I feel like whenever there's an IPO, it kind of highlights what's been happening in the industry. So good for SpaceX, I guess, and I guess I'm not sure about Anthropic anymore because of all this government developments, but certainly they're in the pipeline for the IPO together with OpenAI, also for about like trillion each. The question I was asking in the article is that, first of all, I'm just gonna be kind of maybe like negative here, but
That's so surprising.
but like, but we have like players like Doximity with actually great innovations, but like in a very specific like areas, like, you know, they talk to clinicians saying, oh, you know, we still use fax. So all of a sudden they're like, oh, here's, you know, doc fax for you, great innovation. Patients are saying, oh, you know, we use iPhone, but we don't have telehealth. This guy's all of a sudden they're like, yeah, here we go. You know, you have your dialer. But I feel like on a great like scheme of things, there's like no like iPhones, like no Teslas that we have in health tech. It's always like, okay, let's wait for like big IT, big AI develop something, and then we create something on top of that, you know. Like,
That's because we have really narrow TAMs.
and so
Healthcare is a giant end market, but each TAM you can sell into is so tiny that you can't really do a lot of these things.
well, that's exactly my point. There's a ceiling. It seems like with all this IT plays outside of healthcare, there is almost like no ceiling. You're going to space, whatever you build, whatever data centers on Mars. Here we also have to think, okay, so who am I dealing with? Am I selling to Epic? Am I partner with them? United, you know? It's always like, it seems like there are more limitation, and honestly, like I haven't seen outside of like small pockets of like really interesting innovations, like a big one that would basically wipe out the industry or like something like that. So that's why I was maybe a little pessimistic, but kind of observing, like a little looking back and reflecting on the IPO market. You know, I'm thinking maybe that's why we don't have so many IPOs in health tech, especially let's be honest, like all this price has been inflated.
I think that's the reason you don't have a lot of IPOs in health tech? Not that I did that for a career or anything, but
when you don't have innovation, in my opinion, you don't have earnings. When you don't have earnings, you've been an investment banker. Would you take somebody public?
I haven't been an investment banker for a really long time. I was a research
with no
analyst.
bottom line, so.
A lot of companies come public with no earnings. That's actually one of the reasons they want to come public, so they have actually access to
and then we
public
see what happens to them in
capital.
public markets. They're all going down. So not
Amazon. You think Amazon should focus on their profit as opposed to focusing on the growth?
No, I'm not talking about.
Well, so you're.
Amazon, no,
this is your
at the
argument.
time of IPO, Amazon was profitable. What are you talking about?
You've had so many arguments always of like, oh, health tech doesn't work because it's not profitable, and this is the big issue. No, the
issue is innovation. That's why it's not profitable. The issue is innovation.
The issue, and we've discussed this before, is unit economics. It's like a lot of the things that are profitable in health tech end up being profitable at a very, very low level because you're selling into the government or you're selling some sort of device. And then anything that's super profitable, like a Doximity, like there's a few and far between. And Doximity was an incredibly hot IPO. The reason you're not seeing a lot of health tech IPOs is because the comps are terrible in the public market. And so no one wants to go public at a valuation of like 1 times revenues because that doesn't jazz anyone.
I feel like Doximity is an exception. They were fiscally responsible early. I feel like they focused, and by the way, they got pharma ad dollars, which also helped, which is, let's be honest, profitable. So they focused on that area, like how do we make the bottom line, as opposed to all this like multi-billion private companies saying, oh, let's just spend money on this, spend money on that. There is no, I never hear like, oh, when are we gonna make money? What are we gonna create that actually helps economics, that helps in many cases innovation?
Well, when you're selling into a regulated industry, it's very hard to make a huge amount of profit. I think that's something that you just need to go and accept if you're investing in health tech. And a lot of the public health tech names sell into the provider or payer end market. And no coincidence, things that sell into the provider end market often don't have a very healthy margin because they're selling into environments that don't exactly have the healthiest margin either. Like no one's looking at hospital margins and being jazzed by it. And if you're selling into the pharma end market, probably you're making a much better margin because they have deeper pockets and they're able to do that. Selling into the employer market, sometimes it works, sometimes it doesn't. It really fluctuates based on employer health.
So, okay, I agree with your point, but also to strengthen my point, when I look at successful companies, okay, Doximity has its own thing, but a lot of those companies that went public, you probably would call them medtech. So there's a lot of medtech players, because it speaks to my point that they've either innovated some tech or created their own device, so a very specific device. So yeah, great, that was an innovation, and that's why publicly they're doing well. They're making money. There is hard to compete with them because they're innovators. A lot of what's happening in private markets, I feel like there is competition, copycats, as I mentioned in my articles. Companies kind of moving away because it's just. They're like fly-by-night companies, and even like this VC-backed companies. A lot of them, I just don't see. We talked about it. I don't see the moat. I think Doximity again is an example, and that's why maybe we have Amit here.
I was going to say, I'll swim outside of my lane. I don't have the financial and analytical experience that you guys do. I think it's harder to memify things in healthcare, right? Like the tangible reality. When you just ask a normal person about healthcare, particularly in the United States, is usually rooted in some like negative experience that they've had or evidence that they can point at about things not going that well. Whereas we're talking about like going to Mars, right? Like from what I've read as a casual observer, the physics don't work for data centers in space. But it sure shit sounds cool, and like in terms of investing money into that end with TAMs that defy arithmetic or any other kind of math that I'm aware of, there's a lot of positive and openness there that I think the lived experience of healthcare doesn't provide as many people. That would be my gut on it, not coming from a financial perspective. And then going back to this concept of like how tortuous the system is. Theoretically, one of these companies could like take the whole thing. And then now we're talking about ownership stakes of this next era of humanity beyond even just like healthcare within it. That's a lot more difficult to do. Even the hype around healthcare AI right now is still constrained by the healthcare-ness of it. We're talking about numbers that we can have our own opinions about how real they are. That's like 90% AI driving those valuations as opposed to anything related to healthcare. I think the actual practical reality of those businesses when they run into the wall that is healthcare and actually running a successful company in the healthcare industry will probably bring a healthy dose of reality to those scenarios, which maybe physics will to SpaceX data centers. I don't know enough about it, but I think just the promise permits this sloshing around of capital in a very rapid way that opens up things that it defies logic, right? I think you can go public, you know better than I do, without earnings. But the theory, from my perspective, is eventually there will be profits that these investors will partake in.
You're going to eventually have to go and pursue that.
The path from here to there, I definitely don't know or understand for any of the companies in question here. But it would be, I will be watching from the sidelines, excitingly cheering all of them on.
My first big thought is that we have been living in a golden age of VC-sponsored AI, right? Like, they're kind of footing the bill for a lot of this, you know, and I'm you know, burning a bottle of water every time I want to go and learn a new recipe. And so I wonder if those companies going public, like OpenAI and Anthropic, will then really impact how a lot of folks are able to use AI right now, because it might be a little bit more expensive because they'll be focusing on their margins.
Yeah, that has the capacity to change everything, I would imagine, right?
I want to thank you guys for keeping it short, as I asked you. But no, it's
just
great.
cut Sergei's for it.
Yes, I will.
That's 5 minutes.
Yeah, right.
But thanks so much. Great conversation. Another great episode. Definitely is something we can continue discussing in our future episodes. So thank you guys, and see you in the next episode.
Thank you for having us, and thank you guys for joining.